When our patients come in and see us, they're usually there because there's something in their life that's creating suffering. Maybe it's a lack of energy, or it's chronic pain, or maybe it's not being able to get a good night's sleep. Oftentimes, our clients are going to phrase their issues in a complaint or in a negative term. What this means is they'll say something like, "I just don't have enough energy," or maybe, "I'm always tired and fatigued." Maybe they say, "I just don't sleep," or maybe, "I have pain and discomfort in my shoulder." Now the list goes on. What we could do though is we could reframe this in a positive frame of reference. Instead of saying, "I just don't have enough energy," one could say, "I need help getting more energy." Instead of saying, "I'm always tired and fatigued," we could say that our clients would like to have more energy. If they say, "I don't sleep well," we could then maybe reframe it and say they need help getting a good night's sleep. You see the idea. The important part about rephrasing a client's complaint in such a way is we begin to see that with every major issue a client has, ultimately they have a goal. The goal is to get a better night's sleep, or the goal is to decrease the amount of pain they're in, or maybe the goal is to have more energy. When we understand that in reality, our patients are coming to see us for our ability to help them achieve their goal, we can start to make a more significant change. When I'm working with my patients, I do my best to make sure I understand the end goal. Once that's firmly established, we can then start to use tried and true methods to help them attain their goal. And it doesn't matter if the goal is to have a better night's sleep, or maybe their goal is simply to save enough money to go on a dream vacation. We can use the exact same steps to make a goal happen. Let's take a look at the basics of setting a goal and how to successfully accomplish it. While there are many different goal-setting systems out there, one of the most tried and true methods is called the SMART goals system. A SMART goal is specific, more simple, maybe it's sensible. It's also measurable, maybe another word is meaningful. It's achievable, it's relevant, and lastly, it's time-bound. It has a time limit to it. Let's use an example from clinical practice and see how we can apply this idea. Once you have a goal in mind, make sure it's specific and concise. If it's too complicated, it might be hard to focus your efforts and you might lose motivation. So when coming up with a specific goal, try and answer these questions. Why do I want to accomplish this? Why is this goal important? And what are the obstacles that I may encounter? Let's use a specific example from practice. Now, a bad example is a client saying something like, "I want to feel better." This just isn't specific enough, so we need to dig a little deeper. Imagine you have a client coming in and they're complaining of shoulder pain. Now, we'll assume this type of shoulder pain is in fact treatable. The goal then is to decrease shoulder pain. Now, it's important that we've set a goal like this, but we can use the answers to our questions to help motivate our patient even more. They might want to decrease shoulder pain so that they can play with their grandchild more. The goal becomes a little bit more important now because the pain is interfering with them living their life fully. The obstacle might be that they're not able to get enough treatment, or maybe that they can't do their home care. And we'll work through these obstacles together. Now that we have the details, and while we're aiming to decrease shoulder pain, and that's a good goal, we could make the goal even better. Maybe we could reframe it and say, "You want to play with your grandchildren pain-free." By phrasing it this way, we've made it specific, concrete, and even more attainable. It's important to have a measurable goal as well. That helps us keep on track and keep track of our progress and stay motivated. Finding a way for your patient to assess their own progress, as well as having your own empirical metric, this is very helpful. So when they start to see progress, they'll feel excited as they get closer to their goal. A measurable goal should address questions such as how much, how many, and in our case, how will I know I've accomplished my goal? Let's use the shoulder example again. We could do basic mobility testing, and using a mirror, we can let our patients see how far they can abduct their shoulder. make sure that you give them something very tangible to work on. You could say something like, so you see, you can lift your arm about 45 degrees to the side. We're going to improve upon that. When you know full well that a healthy shoulder can go up to 180 degrees, every time that we get one little degree of improvement, we're taking a step towards achieving that goal. When setting a goal, it's also very important to make sure that the goal is attainable. This helps us be successful. A good goal should push the limits of your comfort, but should also remain within your abilities. When testing to see if a goal is achievable, ask some of these questions. How can I accomplish this goal? How realistic is this goal based on the reality of the condition? We'll come back to that one in a moment. When helping your clients set a goal, it's incredibly important that you let them do as much of the work as possible in setting it, so you can ask them how they would accomplish this goal. If they're having a hard time coming up with the answers, then by all means give them some suggestions. But make sure that you work together with your client or your patient to come up with the steps that they can achieve. For the shoulder pain, maybe the required steps will be to get weekly treatment, to do their home care every single day, and to stop doing activities that aggravate that shoulder. Now moving on to that second question, which was how realistic is the goal based on the reality of the condition? This is where you need to make sure that you set realistic expectations. Perhaps the problem is such that 100% recovery, it's just not possible. We won't be able to regain full range of motion after, say, a third shoulder surgery. Indeed, it might be possible, but the chances are slim. So we need to pick a more achievable goal, such as having enough mobility to brush your hair pain-free. Relevance means that the goal matters to you and it's in alignment with your other goals. While relevance tends to be a little bit more applicable to career goals and life goals, there are some situations in a clinical setting which a patient is trying to accomplish something that's not relevant to them. In other words, they just don't care about it. So when trying to hone in on relevance, we can ask questions like these. Does this seem worthwhile to you? Is this the right time to accomplish this goal? An example of a non-relevant goal would be when somebody comes into the clinic and they say something like, my wife said that I should come and see you for my shoulder pain, so I stopped complaining and I can finally mow the lawn again. Now, from the tone of this comment, the goal is much more relevant to this patient's wife than it is to him or herself. Even so, with asking these relevance questions, we might be able to help our patients or clients see how this is indeed relevant to them. Time refers to the amount of time you plan to take to achieve the goal, and every single goal needs a target date. So when setting a SMART goal, set a specific date or a general time frame. Setting a clear timeline for completing a goal, this helps you stay focused on reaching it, and we go step by step and make our progress. And as you progress towards the goal, if you and your patient feel that the timeline is no longer relevant and it no longer works, no problem. You can simply adjust it. So continuing with this shoulder example, they might say, my granddaughter's birthday is in 3 months and I would love to be able to play with her pain-free. This is perfect. It sets a clear date. So when making sure that date is set, it's helpful to keep the patient motivated and helps them participate in doing their home care. Now remember when we made sure that a goal was achievable? That step laid out steps required to accomplish the goal. With that step laid out and a timeline set, the patient will be a little bit more motivated. One important note about time-bound goals when we're working with our patients. We have to make sure that we are being realistic. If a patient is 150 pounds overweight and their goal is to lose that weight in 2 months, we need to adjust the timeline so it's more in alignment with what is possible and with what is safe. Some patients, they just want to rush the process, but you need to make sure that they understand, truly, the only way to accomplish a long-term goal is with baby steps, one little bit of improvement at a time. If you'd like a free copy of the goal setting worksheet that I used in this video, you'll find the link in the description below. Thanks for watching. Be sure to like and subscribe. We add new videos regularly that help you become a better practitioner.